Scene safe? Yes. Is this my only patient?
Yeah.
Mechanism of injury was ejection with a rollover. I'm going to request ALS backup, and I'm going to take C-spine stabilization. I'm going to turn this over to my partner. And then I'm going to... sir, can you hear me? Does my patient respond?
No.
Do a sternal rub. Does he respond to that?
Grounds and pulls.
He moans, pulls arms inward, okay. Formed a poor general impression based on the mechanism and his level of consciousness. Direct my partner to a modified jaw thrust, and I'm going to look, listen, and feel for breathing. Is my patient breathing?
Yes.
He is. What's the rate? What's the quality?
28 and shallow.
28 and shallow, okay. I'm going to direct my partner to insert an OPA. Does he accept it?
Yes.
I'm going to assist ventilations 12 to 20 times a minute with a back valve mask hooked to 100% oxygen. I'm going to expose the chest. I see a puncture here. Do I see bubbling? Yep. I'm going to cover my gloved hand, direct the partner to apply an occlusive dressing tape on 3 sides. I'm going to palpate the chest wall. Do I note any crepitus? No. I'm going to listen to lung sounds. What do I hear? Diminish?
Clear.
What do I hear? Diminish?
Well, I guess it would.
What do I hear? Clear. What do I hear? I'm going to check the carotid and the radial. What's the rate? What's the quality?
130.
Weak, thready radial, strong carotid. Rate of 130.
Yeah.
Okay. Skin color, temperature, and condition.
Cool, clammy, and moist.
Pale, cool, and sweaty. Very nice. I'm going to. I see a large area of red on these scrubs that this guy's wearing. So I'm going to open that up, and is this arterial bleeding?
Yes.
It is. I'm going to get a big bulky dressing, trauma dressing, apply direct pressure. Does that control the bleeding?
No.
I'm going to direct a partner to apply a pressure dressing and apply direct pressure on that for at least 10 minutes. If that doesn't stop it, we apply a tourniquet. All right. At this point, I've determined that this is a rapid transport patient, critical patient. In order to get him in the ambulance, I'm going to do a rapid trauma assessment. Right. White gloved hands. I'm going to feel the top of the head, behind the neck, palpate the chest wall. Palpate the abdomen, all 4 quadrants. Do I note any DKBTLS? Is it soft? Okay. And push down, push in on the pelvis. Is it stable?
Yes.
Bleeding's controlled here. Do I see any other life-threatening injuries to the lower extremities, the upper extremities? No? I'm going to direct my partner to apply C-collar, and we're going to log roll to the injured lung side. Headman's count.
1, 2, 3.
And I'm going to check the posterior. Do I see any BTLS, the back of the head, the back, lumbar, buttocks, lower extremities?
No.
Count 3, headman's count.
1, 2, 3.
We'd secure him, nipple, navel, knees, head blocks, load him in the ambulance. Is there anybody there? Give me a sample history.
No.
No? I'd like a baseline set of vitals. Can I have a blood pressure? 98 over 48.
Yeah.
I'd like a respiratory rate when we're not breathing for him, still 28 and shallow, okay? And heart rate, 130.
30.
Okay. At this point, we're headed to the hospital. I'm going to do, you're free. He's secure to the backward. I'm going to do a detailed physical exam. I'm going to palpate the top of the head, looking for any DCAT, BTLS, the facial bones, check pupillary response, are pupils equal and reactive. I'm going to look in the ears and the nares for any blood or spinal fluid. Open the mouth. Do I see any broken teeth, any lacerations or tears to the tongue? No. Jaw. Is the trachea midline?
Yes.
Are the jugular veins flat? Okay. Palpate the collarbones. Palpate the chest wall again. Is this still hip holding?
Yes.
Listen to lung sounds a second time. What do I hear?
Finished.
What do I hear?
Finished.
What do I hear?
Clear.
What do I hear?
Clear.
Palpate the abdomen, all 4 quadrants. Soft.
Yeah.
Push down, push in. Stable. Do I note any injuries to the genitalia? Is this controlled? Okay. I'm going to palpate the lower extremities, and I'm going to check SMCs in both feet. I'm going to check for pulse. It's got a good pulse in both feet?
Yeah.
Cap refill. And I check sensory and motor if he could respond to me. I'm going to check both upper extremities. Do I note any DCAT, BTLS?
No.
No? I'm going to check pulses, cap refill. I'd probably, if he was awake, I'd check sensory and motor function. I would like a repeat set of vitals. What's the blood pressure?
90 over
Ooh.
40.
Okay, heart rate,
Still
130.
130.
and respiratory rate when we're not breathing for him?
28.
All right. We cover him with a warm blanket because he's in shock, and we call a report to the hospital and wrap quickly. Is there anything else you'd like to do? No. Nope, nothing.